So my topic of today is FLACS and intumescent, cataracts, PPC, and zonulopathy. Femtosecond laser-assisted cataract surgery for the white cataract, as Dr. Suchin Fake et al. Have already published and told that there is no anterior or posterior capsular tear occurred in their study. The risk factors for incomplete capsulotomy were usually due to Morgagnian cataracts and lens thickness. So the conclusion is the main complication of FLACS and white cataract was only incomplete capsulotomy, significantly associated with Morgagnian cataracts and increased lens thickness. Then there have been studies which have compared the femtosecond laser cataract surgery with the conventional one and showed that for hard nuclear fragments, FLACS conserved phacoemulsification power, provided a significant reduction in corneal endothelial damage, and led to faster visual rehabilitation. So this was a case which we had done long back in 2012 when we had LensX, and that time the technology was just evolving. So we tried it on the white cataract, and you can see the capsulotomy time was little more than what we have now. And there was a significant, the famous volcanic eruption of the the intralenticular fluid. So now with the advantages, we can complete the capsulotomy within 1 second, and we always have an advantage of closed chamber. And the capsulotomy by FLACS, especially in fibrotic cataracts, makes it easier as it cuts the capsule over the fibrotic bands. So this is a case which we did recently. So if you see here, what you have to do is you have to just go on slowly, follow the capsular rhexis margin, maneuver the flap in a circular way, and take the capsule out. And we had done the fragmentation also. You can see how clearly it was. It helped us in partial fragmentation, which helped in less phaco power, thereby protecting the endothelium. Coming to the FLACS and PPC, as Dr. Mahipal has already published this paper, which has showed us that we can detect the pre-existing posterior capsular dehiscence before only, as we have an advantage of anterior segment OCT in FLACS, which increases the safety in posterior polar cataract. Similarly, Dr. Basavada has shown a new way where we can do femto delineation and we can avoid hydrodissections or anything in posterior polar cataract, which will increase the safety in posterior polar cataract. So what we have to do is we have to just set an offset of 800 to 1000 microns away from the posterior capsular margin, so that there is we can save the posterior capsule. So this is a case which we recently did, and luckily this was a female who was a very VIP patient, and she was referred from some surgeon because of the posterior PPC. And in this ASOCT, we can see that there is a dehiscence which was noted before we started the surgery. So it gave us confidence, and we tackled the surgery in a very meticulous manner. I'm showing the surgery as well. So here, if you can see, we did a stop and chop technique. We followed all the low fluidics parameter, and we divided the nucleus in a very gentle way. As Dr. Rohit has shown how to do the PPC, we did cross chopping, and then we eventually took out the nucleus, the chopped nucleus, and eventually the whole nucleus was brought out into the anterior chamber. I will just fast forward it. It was brought out in the chamber, and you can see we could save the posterior capsular tear from extending. And as it was didn't extend because we did it very carefully, and we could implant an IOL in the back. Coming to the FLACS and zonulopathy, it has been described in detail by Dr. Cyrus Mehta. This is a case with a generalized zonulopathy with nystagmus, where we had an advantage of FLACS, and you can see how beautifully the rhexis was done, and we just followed the rhexis in a circular way, and we could complete it. This is another case of FLACS where you can see the lens was tilted, and we had customized the rhexis according to the scanned capsule. We made a 4 millimeter of rhexis, and as we can avoid all the challenges related to capsule rhexis and zonulopathy with FLACS. Thank you so much. I'll be finishing in time, and I will be forwarding it to other people, and I'll be very happy to announce that the same course has been presented in American Society of Cataracts Refractive Surgery, and we are doing it from the last 2 years. Thank you so much.